Welcome. Today we'll explore the concept of service evaluation, particularly in the context of diagnostic radiography. Service evaluation is a systematic process used to assess the value, quality, and effectiveness of a service. In healthcare, this means looking closely at how services like diagnostic radiography contribute to patient care, safety, and overall outcomes. By understanding service evaluation, we can identify strengths, areas for improvement, and ensure that patients receive the best possible care. Let's begin by understanding what service evaluation really means and why it's so important in the world of diagnostic imaging. Diagnostic radiography is a branch of medical imaging that uses X-rays and other imaging technologies to diagnose diseases and injuries. Radiographers play a crucial role in capturing accurate images that help doctors make informed decisions about patient care. The quality of these images and the efficiency of the radiography service directly impact patient outcomes. Understanding the basics of diagnostic radiography sets the stage for evaluating how well these services are delivered and where improvements can be made. Evaluating radiography services is essential for ensuring high standards of patient care. Service evaluation helps healthcare providers identify what's working well and what needs improvement. It also ensures that resources are used efficiently and that patients receive timely, accurate diagnoses. By regularly assessing radiography services, hospitals and clinics can maintain safety, improve patient satisfaction, and stay up to date with technological advancement. Service evaluation in diagnostic radiography involves several key elements. These include assessing the quality of images produced, the efficiency of service delivery, patient safety, and the overall patient experience. Each of these elements provides valuable insights into how well the radiography service is functioning. By focusing on these areas, evaluators can develop a comprehensive understanding of the service's strengths and weaknesses. One of the most important aspects of service evaluation in radiography is image quality. High-quality images are essential for accurate diagnosis and effective treatment planning. Evaluators look at factors such as clarity, contrast, and the presence of artifacts. Consistently high image quality indicates a well-functioning radiography service, while poor image quality can lead to misdiagnosis and compromised patient care. Efficiency is another critical factor in evaluating radiography services. This involves assessing how quickly and smoothly patients move through the imaging process, from scheduling appointments to receiving results. Efficient services reduce patient wait times, increase throughput, and make better use of resources. Evaluators often track metrics such as average wait times, examination duration, and report turnaround time. Patient safety is paramount in diagnostic radiography. Service evaluation examines how well safety protocols are followed, including radiation protection measures and infection control. Ensuring that patients are exposed to the lowest possible dose of radiation while still obtaining quality images is a key goal. Evaluators also look at how well staff are trained in safety procedures and how effectively risks are managed. Patient experience is a vital part of service evaluation. This includes how patients feel about the care they receive, the clarity of communication, and the comfort of the imaging environment. Positive patient experiences can lead to better cooperation during procedures and higher satisfaction rates. Evaluators often use surveys and feedback forms to gather patient perspectives and identify areas for improvement. Advancements in technology have transformed diagnostic radiography. Service evaluation now includes assessing the use of modern imaging equipment, digital systems, and software that enhance image quality and workflow. Evaluators consider how well technology is integrated into daily practice and whether staff are adequately trained to use new tools. Keeping up with technological changes is essential for maintaining high standards. Skills and knowledge of radiography staff are crucial to service quality. Service evaluation looks at staff qualifications, ongoing training, and professional development opportunities. Well-trained staff are more likely to produce high-quality images, follow safety protocols, and provide excellent patient care. Regular training ensures that staff stay current with best practices and technological advancement. Service evaluation involves measuring outcomes such as diagnostic accuracy, patient recovery rates, and the impact of radiography on treatment decisions. These outcomes provide concrete evidence of the service's value. By tracking and analyzing these metrics, healthcare providers can demonstrate the effectiveness of their radiography services and identify opportunities for further improvement. Patient satisfaction surveys are a valuable tool in service evaluation. These surveys ask patients about their experiences, including wait times, staff interactions, and overall satisfaction with the radiography service. The feedback collected helps identify strengths and areas needing attention. High satisfaction scores often reflect a well-run service that meets patient needs effectively. Peer review and audit processes are important components of service evaluation. In radiography, this means having experienced professionals review images and procedures to ensure they meet established standards. Regular audits help maintain consistency, identify errors, and promote continuous improvement. Peer review fosters a culture of accountability and learning within the radiography team. Benchmarking involves comparing radiography services to national or international standards. This process helps organizations understand how their services stack up against best practices and industry benchmarks. By identifying gaps and areas for improvement, benchmarking drives quality enhancement and ensures that patients receive care that meets or exceeds accepted standards. Evaluating the cost-effectiveness of radiography services is crucial for resource management. This analysis looks at the balance between the costs of providing the service and the benefits it delivers to patients. Cost-effective services maximize value by delivering high-quality care without unnecessary expenses. This ensures that healthcare resources are used wisely and sustainably. Data and analytics play a significant role in service evaluation. By collecting and analyzing data on service performance, patient outcomes, and operational efficiency, healthcare providers can make informed decisions. Analytics help identify trends, predict future needs, and measure the impact of changes. This data-driven approach supports continuous improvement in radiography services. Service evaluation helps identify gaps in radiography services, such as delays, equipment shortages, or training needs. Addressing these gaps is essential for maintaining high standards and ensuring patient safety. By taking corrective actions based on evaluation findings, healthcare providers can enhance service quality and patient outcomes. Continuous quality improvement is a core principle of service evaluation. It involves regularly reviewing and updating processes to enhance service delivery. In radiography, this might mean adopting new technologies, refining protocols, or providing additional staff training. The goal is to create a culture of ongoing improvement that benefits both patients and staff. Effective service evaluation involves input from a range of stakeholders, including patients, radiographers, doctors, and administrators. Engaging stakeholders ensures that different perspectives are considered and that evaluation findings are relevant and actionable. Collaboration among stakeholders leads to more comprehensive and effective service improvements. Compliance with regulatory requirements is a key aspect of service evaluation. Radiography services must adhere to laws and guidelines set by health authorities and professional bodies. Evaluators check for compliance in areas such as radiation safety, patient confidentiality, and equipment maintenance. Meeting regulatory standards protects patients and ensures the credibility of the service. Ethics play a significant role in the evaluation of radiography services. Evaluators must ensure that services are delivered fairly, respectfully, and without discrimination. Ethical considerations also include informed consent, patient privacy, and the responsible use of technology. Upholding ethical standards builds trust and supports high-quality patient care. Risk management is an important part of service evaluation. This involves identifying potential risks to patients and staff, such as equipment malfunctions or procedural errors, and implementing strategies to minimize them. Effective risk management ensures a safe environment and reduces the likelihood of adverse events in radiography services. Patient-centered care is at the heart of service evaluation. This approach focuses on meeting the unique needs and preferences of each patient. In radiography, it means providing clear information, respecting patient choices, and ensuring comfort throughout the imaging process. Patient-centered care leads to better experiences and improved health outcomes. Effective communication is essential for high-quality radiography services. Service evaluation examines how well information is shared among staff, patients, and other healthcare providers. Good communication ensures that everyone involved understands the procedures, results, and next steps, reducing confusion and improving patient care. Accessibility is a key factor in evaluating radiography services. This includes the ease with which patients can schedule appointments, reach the facility, and receive timely care. Evaluators look for barriers such as long wait times, limited hours, or transportation challenges. Improving accessibility ensures that more patients can benefit from diagnostic imaging. Cultural competence is increasingly important in healthcare service evaluation. Radiography services must be sensitive to the diverse backgrounds and needs of patients. This includes providing language support, respecting cultural practices, and ensuring equitable access to care. Culturally competent services foster trust and improve patient satisfaction. Feedback loops are essential for continuous improvement in radiography services. Service evaluation establishes mechanisms for collecting, analyzing, and acting on feedback from patients and staff. This ongoing process ensures that services evolve to meet changing needs and expectations, driving higher quality and satisfaction. Radiography services often work closely with other departments, such as emergency, surgery, and oncology. Service evaluation looks at how well radiography integrates with these services to provide seamless patient care. Effective integration reduces delays, improves communication, and enhances the overall patient journey. Healthcare is constantly evolving, and radiography services must adapt to new challenges and opportunities. Service evaluation helps organizations respond to changes such as new regulations, emerging diseases, or technological innovations. Being adaptable ensures that radiography services remain effective and relevant. Efficient resource allocation is vital for high-quality radiography services. Service evaluation examines how resources such as staff, equipment, and funding are distributed to meet patient needs. Proper allocation ensures that services run smoothly, avoid bottlenecks, and deliver consistent care. Radiography staff often face high workloads and stressful situations. Service evaluation considers staff well-being, workload management, and support systems. Addressing these factors helps prevent burnout, maintain morale, and ensure that staff can provide the best possible care to patients. Innovation drives progress in diagnostic radiography. Service evaluation encourages the adoption of new techniques, equipment, and approaches that improve image quality and patient care. By fostering a culture of innovation, radiography services can stay at the forefront of medical imaging and deliver better outcomes. Environmental sustainability is becoming increasingly important in healthcare. Service evaluation looks at how radiography services manage waste, energy use, and environmental impact. Sustainable practices help reduce costs and support the health of both patients and the planet. Handling complaints and incidents effectively is a key part of service evaluation. Radiography services must have clear procedures for addressing patient concerns and investigating incidents. Learning from complaints and mistakes helps prevent future issues and improve service quality. Accurate documentation is essential for effective service evaluation. Radiography services must maintain detailed records of procedures, outcomes, and evaluations. Good record keeping supports accountability, facilitates audits, and ensures that information is available for future reference. Learning from best practices is a powerful way to improve radiography services. Service evaluation involves identifying successful approaches used by other organizations and adapting them to local needs. Sharing knowledge and experiences helps raise standards across the board and fosters a culture of excellence. Transparency is vital for building trust in radiography services. Service evaluation promotes openness about performance, challenges, and improvement efforts. Transparent communication with patients and staff ensures that everyone understands how services are evaluated and what steps are being taken to enhance quality. Setting clear goals and objectives is a key part of service evaluation. Radiography services should define what they want to achieve, such as reducing wait times or improving image quality. Clear goals provide direction and make it easier to measure progress and success. After identifying areas for improvement, it's important to implement action plans. Service evaluation includes developing strategies, assigning responsibilities, and setting timelines for changes. Effective action plans ensure that improvements are made systematically and that progress is tracked over time. Monitoring and regular review are essential for sustaining improvements in radiography services. Service evaluation involves ongoing assessment of performance, outcomes, and patient feedback. Regular reviews help ensure that changes are effective and that services continue to meet high standards. Recognizing and celebrating successes is an important part of service evaluation. When radiography teams achieve their goals or make significant improvements, it's important to acknowledge their efforts. Celebrating success boosts morale, motivates staff, and encourages a culture of excellence. Every service faces challenges, and radiography is no exception. Service evaluation helps identify obstacles such as limited resources, staff shortages, or technical issues. By addressing these challenges proactively, radiography services can continue to improve and provide high-quality care. Future of service evaluation in diagnostic radiography will likely involve more advanced technologies, greater patient involvement, and a stronger focus on outcomes. As healthcare evolves, so too will the methods used to assess and improve radiography services. Staying ahead of these trends ensures continued excellence in patient care. Summarize: service evaluation in diagnostic radiography is a comprehensive process that assesses quality, efficiency, safety, and patient experience. It involves input from multiple stakeholders, uses data and feedback, and drives continuous improvement. By regularly evaluating services, healthcare providers can ensure that patients receive the best possible care. Thank you for joining us on this journey through service evaluation in diagnostic radiography. By understanding and applying the principles of service evaluation, healthcare providers can enhance the quality and value of radiography services. Ultimately, this leads to better patient outcomes, greater efficiency, and a stronger healthcare system. Stay committed to continuous improvement and excellence in patient care.